There are many fears about the U.S. government converting to a universal healthcare system, but it would be far more beneficial than we think. The U.S. pays the most money for one of the least efficient healthcare systems in the world. The U.S. pays $8,233 per person for the year. Per person for that year, just like one person, pay that much for one person's health care a year. Other countries that have universal health care pay $3,000 to $4,000 less than the U.S. per year on health care, and it's much more effective health care. 36 other countries have universal health care, including Canada and France. Most universal health care systems are publicly funded by taxes and provide efficient and effective health care to their citizens. The main goal of universal health care is for people to be able to obtain quality health services without struggling to pay for them. Many countries have health care systems, and even though the systems may vary, they all have that main goal in mind. These systems usually boost the country's economy as well. It helps boost the economy by being tax funded, also by businesses not having to pay for employee insurance because the government provides it for them, so that the small businesses can make more money by not having to pay for employee health insurance. So as you can see, it's very beneficial to the people and the government
Thank you.
Okay, Blue Cross and Blue Shield of North Carolina says the cost of insurance is rising. Healthcare has doubled over the last decade due to all administrative costs that come with insurance paperwork, government regulation, and healthcare system billing hassling. We've spent 3 times more than France on medical administrative costs. Insured families pay an additional $1,700 yearly premiums to cover uninsured patients. Some surgeries alone can vary from $10,000 just between towns in the same hospital in town.
With insurance, it wouldn't be that expensive, so.
With our lack of info, it is driving up the healthcare to $100 billion or more each year, almost as much as education. Buying Medicaid for the blind, disabled, or at age 65 and plus, you end up paying $46,530 after about 10 months. Just to add another individual, it would be $3,773. And for a person with no income and no children or single couples, they would pay $25,800 in just 10 months alone, and $1,262 for adding an additional person. No thank you. Taking up to 90 days for an individual with disabilities to see if they were accepted or not. Canada has had problems with their universal health care, much like other places around the world, like France. Thousands of Canadians participating in nationwide consultation over past years say their country's healthcare system is failed and broken, saying more needs to be done to deliver care where and when it is needed. Yes.
low minimum wage and people who don't have jobs don't have to pay for health care.
Making this matter worse, the more vulnerable, which are the children, elderly, and the disabled, have suffered more in the failment of the healthcare system. Many have spoken of long waits, high costs on prescription drugs, and offering next-day surgery in the private clinic for like $2,000, rather than wait a year or 2 to be done in a hospital. Also, they spend less on administrative and more on frontline workers and services. By the end of 2014, the U.S. government debt is expected to be $18.247 trillion. It's obvious we are in a tight situation with America's debt to be giving health care to all citizens. We are in an unhealthy place when it comes to medical costs. We are paying more for health care than comparable countries pay, having highest infant rates. More children are overweight or obese. Our life expectancy is 51st in the world. And our unhealthy lifestyles, overpriced drugs, and tax plus more will make this matter worse.
Okay. Any other